Hello and welcome to Foot Levelers version 7 training. In this session, I'll share with you how to discuss the foot scan with the patient. Start by recalling the patient's foot scan and click Next. Now click Colorize. The first area will be to point out the optimal scan and explain that the associate scanner reads pressure. When it is colorized, the software reads the areas where the most blanching occurs and puts it into a red color. This indicates the area where your patient bears their weight. The next area will be weight distribution. Explain that you want to see a 50-50 split, with 50% at the calcaneus in a centered pattern, and the remaining 50% in the metatarsal area and toes, and nowhere in between. Any yellow in the areas that should be red could be an indication of a callus formation. Calluses are stress reactions and do not blanch, so they will not present in a red color. From there we will discuss the three arches of the foot and how they relate to foot dysfunction. Select the optimal patterns from the drop-down menu. The lateral arch should be free of any red. The medial arch. If you draw a line down the medial aspect of the foot, the tissue should not pass that line medially. You will be able to show this from the drop-down menu on the right-hand side of the screen. The anterior transverse arch should have a crescent shape, giving the metatarsal area a kidney bean shape. From here we can talk about compromised arches. One arch compromise indicates mild foot dysfunction, whereas two arches compromise indicates moderate foot dysfunction, and ultimately all three arches compromise indicate severe foot dysfunction. Remember that foot dysfunction contributes to postural distortion. Next, involve the patient by asking them a few questions such as, does your right foot look like your left foot? Does your foot scan look like the optimal scan or the mild, moderate, or severe foot? Finally, educate the patient on spinal pelvic stabilizers by teaching them that they provide the support for a balanced symmetrical foundation, enhance the effectiveness of chiropractic treatment, and ultimately improve the patient's quality of life by relieving postural stress. This concludes our training session. If you have any questions, please call our helpful customer service team.